Well, Pastor Walt, I'm really glad that we were able to find some time to actually get together.
Well, it's good to see you finally. Where you been?
Yeah, that's right. I know I was thrilled to see that you'd made an appointment on my calendar, and you have this benefit as a health coach, and we've just never been able to find time to get together. I know you're always running around helping someone or whoever I hear about that's raving about Pastor Walt's great help.
Well, I've got people that try to fit into their schedule to meet them for breakfast or lunch and around their work schedule. And that keeps me occupied, and trying to fit the schedule is...
Sounds like you're really running 24/7.
Or 7/24.
Exactly. So, well, I'm glad that you took the time out to, think a little bit about yourself and spend a little bit of time that we could talk about how things are going for you. You give a lot of your time to everyone else, but it's also good for you to have some balance and think about things for yourself also.
Is it? Really?
Sounds like it, so that's great that you decided to come in.
Well, thank you for letting me come in.
So tell me about how things are going overall. I know you had mentioned in your email that you'd lost some weight recently.
Yeah, I did. Wife quit feeding me. No.
Your wife quit feeding you, huh? Well, I'm sure if she quit feeding you, you would find some other great way to eat.
But that's all good. A little exercise helps on that. And splitting meals, share meals instead of eating that big portion that the restaurant gives you, We split it. That works.
So you really found that when you go out to eat, you both order one portion and share it?
Most of the time.
Okay, so that and then adding more exercise.
More exercise, yep.
That's what seems to have worked for you.
Yeah, exercise helps.
Well, what kind of exercise do you like to do? I mean, you probably get enough exercise just running around between folks.
Well, I do that, but, I roll out of bed and then I run around the block 3 times. Then I kick the block under the bed and go back to bed.
You do you? You have to go for that early morning block and monitor the neighborhood.
Bicycling works.
Bicycling? Uh-huh.
Yeah, that works.
How did you get into that?
Had a bike there, and that's a good place to ride, so that's easy to do.
Okay.
Easy to do, and...
sounds like something you enjoy.
Yeah. Yep, get to check out the neighbors, see what they're doing as you cruise by their place.
Right, and then everyone's waving down Pastor Walt with their latest thing that they're needing to talk to you about. Oh, good. Well, if there was anything about your health you're still thinking about now in terms of, what's your next goal or what your next step or something you're thinking about?
Not really that I know about.
So overall, things seem to be going pretty smoothly for you.
Things are good.
Yeah, so that's awesome. It sounds like you're in a great place, and it sounds like the things you have implemented
It works.
have been working really well.
It works.
Well, on a scale of 1 to 10, like we use that pain scale with people as nurses, how confident are you that you'll continue on with what you've been doing as far as the portions and the bike riding?
Oh, probably a 7, 8.
A 7 or an 8?
Sure.
So pretty confident that things will continue on and that you can maintain what you've been doing. And that's great. I mean, you're not a 0.
Well, yeah, I didn't like 0.
Well, what makes you a 7 and not a 4 in terms of confidence?
I guess that's just the way I am. Is just confident it can be done, and you can do it.
Well, because you've been doing it and you've been consistent and successful with it.
Correct.
And what would it take to make you be a 9 in terms of being more confident that it'll happen all the time?
Oh, just another couple days on the bike, a couple days out would be good.
So what I'm hearing you say is that's kind of what you're wanting to get to, is being able to
a little more.
Add a little more to what your schedule is.
Correct.
And how do you see yourself doing that?
Well, that's the challenge, because if you go to meet people for breakfast at 7:30, 8 o'clock.
Wow, 7:30 or 8 o'clock, yeah.
And try to ride a bike before and shower and stuff ahead, that doesn't work
That
very
means
good.
you're getting up pretty early.
So do you do it in the afternoon when it's 100 degrees? No, that doesn't work either. So evenings maybe.
Okay, so of course the Florida weather, you've got those 100-degree humid temperatures where you feel like you're hot the minute you get on the bike.
Right.
And by the evening, is it cooled down some, or the humidity taken off a little in the evening?
On a rare occasional day.
Uh-huh. So then it's kind of picking those days of when do I feel like going out there and do I feel like sweating right now on the bike.
That's it.
Uh-huh. So that seems kind of like your next focus on just trying to implement that.
Yeah, a little more would be good, but...
Well, it sounds like, you're doing a lot to really think about your house and to have a balance between what you're offering to other people, but also taking time for you. Do you do anything just do you do anything just for you time? Just to, be able to just have your own time to enjoy and unwind?
Like grab a good book.
Mm-hmm.
Yeah.
Grab a good book. That's always a great way to unwind.
Inspirational leadership type
Uh-huh.
books.
And you find that gives you
Not one of those fluffy novel things.
none of the fluffy Harlequins or whatever that the women like to read, huh? Yeah.
Not those, right.
Leadership, something that gives you some more
Some
tools
stuff.
to work with
Correct.
folks that have some depth to them.
Yeah.
Well, that sounds great. If we could just perhaps maybe talk in a couple, maybe 4 to 6 weeks, and kind of see how that bicycling's going for you, and just know I'm here for you, and would
That's
love to
good. So you're
continue.
going to be here?
Yeah, I'd love to continue to be your support.